Humanity suffers from many diseases, but the true scourge of modern times is cardiovascular disease. Heart attacks alone claim over 500,000 lives globally each year, and each attack often begins with a sudden spike in blood pressure. In this video, we will discuss 4 methods to quickly lower blood pressure at home, as well as strategies to reduce it on a long-term basis. What is normal blood pressure? It is often heard that systolic, or upper pressure, is called heart pressure, and diastolic, or lower pressure, is called kidney pressure. However, this association of these parameters with internal organs is fundamentally incorrect. Systolic pressure only indicates the force with which blood presses against the vessel walls during filling, while diastolic pressure indicates the pressure at the moment the heart muscle is at rest. Since our vessels are elastic, the values of upper and lower pressure can fluctuate without risking our health. But if these values exceed normal limits, there is a danger of vessel rupture in internal organs, which can lead to severe bleeding and sometimes death. So, what blood pressure is considered normal? Traditionally, it has been 120/80. However, in recent years, a safe pressure within the range of 140/90 is often mentioned. Anything above this is considered hypertensive or hypotensive conditions and is typically treated. Another myth is that if a person feels fine at high blood pressure, then this is their personal norm, and there is no need to lower it. In reality, feeling well is just a compensatory mechanism of our body, which does not protect against the risk of heart attacks and strokes. Even if lowering blood pressure causes discomfort, it is necessary to do so gradually, allowing the body time to adapt to the new state. We hope you find our videos interesting and ask you to tell your friends and family about them and support us by subscribing to the channel. How can you quickly lower your blood pressure? Long-term treatment for high blood pressure usually involves taking prescription medications regularly, as advised by your doctor. It's important to understand that these medications need to be tailored to each patient's individual response. Lifestyle also plays a significant role. But what can you do at home if your blood pressure suddenly spikes and the medications are not helping enough or at all? Here are 4 simple ways to address this issue. The first method to normalize blood pressure is to use foot and hand baths. Fill a basin with hot water at about 45 degrees Celsius and immerse your feet or hands for 10 minutes. This influx of heat will cause the blood vessels to expand, allowing them to accommodate more blood and causing the blood pressure to begin to drop. It's not crucial whether you immerse your hands or feet, but often it's the feet that are considered more effective at boosting circulation throughout the body. The second method is deep breathing. This is particularly effective when your blood pressure rises due to stress, as proper breathing can help you calm down quickly. Here's how to do it. Lie on your back and take a slow, deep breath, counting to 5, then exhale for the same duration. Try to breathe in a way that fills your abdomen with air. To monitor its movement, place a hand on your stomach. Repeat this exercise for 3 to 5 minutes. The third method for lowering blood pressure quickly is to drink mint tea. To prepare it, steep a small pinch of mint leaves in boiling water for 10 minutes, then strain and drink the infusion. However, it's important to note that mint can enhance the effects of blood pressure medications. Therefore, if you're already taking such medications, proceed with caution when using this method. Another natural remedy for high blood pressure that you can find in any pharmacy is valerian. A tablet of this popular sedative can lower blood pressure in emergency situations by reducing heart rate. How can you address the issue of high blood pressure? It's important to note that the methods described are primarily intended for emergency, short-term relief when experiencing a spike in blood pressure. They are beneficial because they can easily be combined with each other. However, for a comprehensive solution to high blood pressure, lifestyle changes are necessary. Here are some changes that can genuinely help lower blood pressure. 1. Weight reduction. Losing 1 kilogram can reduce your blood pressure reading by 1 point. 2. Regular physical activity. Engaging in physical exercises, dancing, or even walking outdoors for half an hour a day can reduce your blood pressure by 5 to 8 points. 3. Dietary adjustments. Increasing the proportion of fruits, vegetables, and grains in your diet while reducing the intake of refined, fatty, and fried foods can reduce your blood pressure by another 11 points. 4. Reducing salt intake. Limiting yourself to no more than 5 grams of salt per day can lower your blood pressure by another 5 points. 5. Avoiding alcohol and smoking. Ideally, you should quit both entirely. 6. Managing stress. Finally, the most challenging but crucial advice is to avoid stress, as it often leads to increased blood pressure. What are your strategies for managing high blood pressure? Do you know any quick methods to reduce it?